This will be under rescue operations, which the skill sheet is 6-4.1, extricate a victim from the motor vehicle, and actually it's 6-4.1A. The task, you're going to extricate a victim entrapped in a motor vehicle. For the performance outcome, while operating as a member of the team, the candidate shall be able to extricate a victim entrapped in a vehicle so that the victim can be disentangled without causing further injury and managing the hazards. For the conditions, given a vehicle extrication scenario, stabilization and extrication tools, the candidate shall demonstrate the ability to, and under those conditions, realize full PPE in bunker gear or approved vehicle extrication gear. So can be different types of gloves other than structural firefighting gloves. You may have on goggles or different types of helmet protection, but it's what is authorized, approved extrication equipment, PPE, for your organization. On the task steps, number one, you're going to size up the situation, identify hazards, and determine required stabilization and select the extrication techniques. 2, you're going to stabilize the vehicle. 3, cover the victim as required to protect from injury. Number 4, operate both hand and power extrication tools in a safe and efficient manner. Choose one of the following and apply the appropriate techniques for moving or removing. So the vehicle roof, the vehicle doors, the vehicle windshield and windows, vehicle steering wheel and or columns, and the vehicle dashboard. And number 5, you're going to perform extrication techniques so that the victim can be disentangled without undue further injury. You're going to need to stabilize that vehicle first, whether you're going to end up using some types of struts or some types of cribbing. So an approved method for stabilization of that vehicle. Then you're going to operate different types of tools, whether it's going to be on a roof, door, windshield, windows, or the steering wheel or the columns or the vehicle dashboard. You're going to operate those tools effectively and efficiently in a safe manner, and then you're going to perform an extrication technique so the victim can be disentangled without undue further injury. So we're not saying that you have to have medical skills or medical training, but you're going to have to be able to stabilize that vehicle, select the appropriate technique, remove that vehicle from the patient and disentangle them so that we're not going to cause any type of further injury. So one of those key steps is knowing how to operate those tools, which are those other skill sheets, and then applying those different techniques to use those tools on a stabilized vehicle to remove the vehicle from the patient, and then make sure that we can get that patient out with causing any undue further injury. But that PPE and those safety techniques, covering that patient up, making sure that you vocalize and verbalize anything that you are doing to the patient as well as to the evaluator to make sure that you've covered your bases on this skill sheet.
The first arriving company officer gives an initial size-up of the scene as other vehicles arrive.
Okay. Looks like we have heavy damage. Appears we have one occupant still inside.
The collision scene is now surrounded by many emergency vehicles. This allows responders to simultaneously treat the patient's medical needs, extricate them from a trapped position, monitor hazards such as downed power lines, traffic, and fire, and get them ready for transport to the hospital emergency room. Firefighters work to stabilize the vehicle for everyone's safety. This may be as simple as putting chocks under the vehicle, or more involved, using ropes and pulleys. Once the vehicle is stable, a firefighter/paramedic enters to help the patient and will stay by their side throughout the extrication. While the patient's being helped, battery cables are disconnected to prevent airbags from accidentally exploding or power seat belts from engaging. In addition, power tools may be used to create access for patient extrication. In many cases, the vehicle's roof is removed. Following that, doors might need to be removed. And if the patient's legs are pinned, the dash is lifted.
All right, Benjamin, we're going to put a seat collar on your neck. So while you stay still, let us do the work for you, okay?
Firefighters now have safe access for patient removal. With the roof cut out of the way, they're able to keep the patient's spine in line as they lift, preventing further injury. Once the person is out, they're safely secured and transported by ambulance or life flight helicopter.
we just never know. Every single time we go out on a call, it's different. The scenario changes. So we always have to be thinking about how we're going to approach this scene, what kind of safety hazards are there, and obviously, you know, what's going to be the best way to get this person out of the vehicle in a safe way.
Every collision is different. Some vehicles may be on their top. Others may involve multiple vehicles with many patients.
Start working on top of that outside door in case we have to ramp from both directions.
Such situations require numerous tasks to be performed at the same time to quickly remove, stabilize, and transport the injured.